Welcome back to the Hip Replacement Podcast. I'm Chris Bystriansky, your host. I've had both my hips replaced, one a little more than 10 years ago and the other one a little more than 12 years ago. And I'm here to share all the things I've learned over the last 10, 12 years with you. Today, we're going to talk about the numbness or the pain in the legs following the hip replacement surgery. And I've gone through several different types of pains or sensations in the leg. And, no one really prepared me for these things. The doctor mentioned something, the surgeon mentioned something that I might feel some burning or itching. And the physical therapist also mentioned that. But they didn't really prepare me for how long it would last or the intensity of these sensations. So why in the world do we have these sensations anyway? Now, I'd have to point out that I had the anterior approach to the hip replacements for both, meaning the surgeon went through the front of my hips. So what happens in the surgery is that the nerves get either cut or moved, and it takes time for them to regenerate. And sometimes they don't regenerate. But anyway, the end result is that the front of my hips, the front of my legs, and the sides, the outsides of my legs have been experiencing different sensations for years, and it still goes on to a certain extent. Now, the first thing I want to point out is that these sensations I'm going to describe are not around the incision site. Okay, they are literally down the front of my thighs and the sides of my thighs. So, a couple inches away from the incision site. So the first thing that I noticed, and this was shortly after the pain of the hip replacement and the medications, the painkillers wore off a week after the surgery, was that the front of my legs and the sides of my legs were pretty much completely numb. Like I could poke that area of my legs, the front and the sides, with my finger or whatever, and I could not feel anything. So the first big sensation was like complete numbness. Just I had no feeling in the front or the sides of my legs. And that was an issue that was a significant issue until I sort of got used to that, if I've ever gotten used to it, is that I would have something in my pocket, my phone or car keys or anything else, and I did not realize it was there. I mean, if you put something in your pocket right now, in your back pocket, you can feel it through your pockets. I mean, that's just something I did for over 30 years. And, I never thought anything of it. But then you take that sensation away and it's very awkward. I'm walking around the house looking for my phone or my keys, and they're in my pocket. And it took me a while to just realize that, I could have things in my pockets and I'm simply not going to be able to feel them. And that went on for years. All right. The numbness was so severe in my legs, in the front and the sides, for years. All right. And I just had to keep checking in my pockets if I had what I needed, because I just couldn't feel anything. All right. So that was the numbness originally, the original numbness, the original sensation. And that, that would be around 95% of the time on my hips. And then the next sensation that I would have that would take up that other 5% would be a burning sensation. All right. Like my legs were on fire, and it would be quite painful. I look down, it's like, is anything burning? Are my pants burning? Are my shorts burning? What's going on? And I just looked at my legs, and, there's nothing there. And this probably went on for 4, 5, 6 months after surgery. So I would have periods of like complete numbness, followed by short periods of a burning sensation. Now, the burning sensation eventually went away, which was great, but that was replaced by after about 6 months, that was replaced by an itching sensation. And I have to tell you that I think I would rather have had the burning sensation, because the itching sensation lasted for years. And I would be 95% of the time, I would be mostly numb. And then that other 5%, it would be just this incredible itch that I could not scratch. I would scratch my legs and it wouldn't help. The itching sensation would come right back, all up and down the side of my legs and the front of my legs. And it was quite irritating. The burning, at least I could get used to that a little bit, but with the itching, it's so bothersome. I'm trying to scratch. I'm scratching through my leg, through my pants, through my shorts. I'd be sitting at my desk at work, just scratching like crazy, and there was nothing that I could do. But what I found was that eventually the itching did reduce, and that was around for years. Now, it wasn't constant itching. Like I said, it was about 95% numb and then 5% itching. And that lasted for years. All right. So, I'd be walking around. I can't feel what's in my pockets, if there's anything in my pockets. And then the next minute, they're itching like crazy. So that went on for years. And that eventually died down. And what I did was I really used the roller that I mentioned in one of the previous podcasts, those rollers up and down my legs, just to try to impact the muscles and impact the nerves. And maybe it helped. It certainly helped the muscles. I don't know how much the roller helped the nerves, but at least it was a different feeling. Like I could feel the impact of the roller on my muscles a little bit, and it gave me some relief from the itching. But when I was not doing the roller, that itching would just come and go out of nowhere, and there was nothing that I could do to scratch it, because there was nothing on the surface of the skin that I could scratch, not like a mosquito bite or a bug bite or anything like that. The itching came from deep within or under the skin, and there's nothing I could have done to get to it. But that lasted for a couple of years. And then when that eventually left, when that was eventually gone, and I haven't felt the itching in 6-8 years, so that's been good. But what was still there was the numbness. Now, I'm 10 years past one and 12 years past another surgery, and I still have a little bit of numbness in my hips. All right. So I'm probably 75% recovered from the numbness, but it still feels numb. It feels like I have some type of painkiller cream on my hips, and it feels numbness. So I don't know, Bengay or whatever you could put on your hips, Icy Hot or whatever the latest brand is. If you were to put that on your hips and have them go numb, that's kind of what it feels like to me. And the area where the numbness still occurs it's definitely smaller than it was, but it is right where my pockets lay on my shorts and on my pants. But I can feel if I have something in my pocket now, if I really think about it. But it's still there. So, 8-10 years ago, it was a big area of numbness and very extensive numbness. I barely had any feeling, and now it has gotten better. The nerves have recovered or regenerated, or however you say it. And I do have most feeling back in my legs, but that took some time, and it's been over the years, it has just come back slowly. It wasn't something like, okay, after a year, I've got all my feeling back. That certainly did not happen like that. And I had this discussion with the surgeon and the physical therapist years ago, and they mentioned that, yeah, it'll happen a little bit and it should come back, but I'll tell you, it has not come back for me 100%. It's come back about 75%. And I've just learned to, I don't want to say live with it, because it's not really that much of a hassle. I do have most of the feeling back, and that's where we are now. I do not expect it to get any better, But I do notice that if I miss using the roller or some type of stretching in my legs for a few days even, then it seems to get more numb. I don't know why, but I try to use the roller or do something every day. But there are times when I do miss it. I'm traveling or I'm doing something, and I'm just not able to get to the roller or to some of the other stretches that I like to do. And when that happens, I do have more numbness. But to get back to the best feeling that I can get to, the most normal feeling that I can get to, which to me is about a 75% recovery, 75% of the feeling back to my hips, back to the skin on the legs and on the front and the side of my legs, stretching and using the roller and some of the other tools that I mentioned previously seem to help. But that's it. I don't have any more itching. I don't have any more burning sensation. I'm just left with some numbness in the front and the sides, which is totally acceptable to me. I guess it's a little reminder of the surgeries that I had years ago. And, if you have some of these sensations of burning and itching, those should be going away at some point. And then the numbness, if it's anything like my experience, it'll go away mostly, and then you'll still have a little bit of numbness for the long term, but nothing too impactful. So that's it. I hope me explaining my sensations in the legs is helpful to you and helpful to you understanding what's going on. So that's that. Those are the sensations. Now, please, if you like this podcast, please share it with your friends or post about it on social media so that we can grow and help as many people as possible in their recovery so they can get back to living their best life following surgery. So I hope you found this helpful. And until next time, I wish you the best recovery possible. Take care.